Hi guys, my name's Caleb. This is for my health class. So I want to talk about something really cool, and it's going to be about the comparison between Medicare and Medicaid. And it's going to specifically focus on operations that are in Indiana, because believe it or not, I live in Indiana. And while these are like both public healthcare insurance companies, they differ on like who qualifies, what services they cover, and who administrates them, and their overall scope. And I'll be also using the CMS fact sheet I read in class for this. So, well, let's get straight into it. Why not? So, first off, let's talk about Medicare for a second. If you all didn't know, Medicare is a federal health care coverage organization. Basically, they cover for certain things that you may not pay for. Health expenses are pretty expensive, so that's why they're there. Meaning it's administered at a national level and functions similarly in every state, including Indiana. But according to the CMS fact sheet I read that was assigned in class, usually Medicare covers people aged 65 and older. Certain individuals qualify under 65 disabilities as well, and people with also for some reason with end stage retinal disease. And it's basically divided in several parts, like Part A, hospital insurance, medical insurance, Medicare Advantage, and prescription care drug coverage. Because I can speak to myself, my sister always has to go to get her meds at CVS, and usually Medicare usually covers that. Because if you didn't know, prescription drugs are very, very expensive, because obviously they're there to help you out with whatever kind of thing you got going on. Either if it's ADHD or going for major depression episodes, those drugs can really help you improve your mood, which is why they're expensive. But which is why Medicare exists, so they can cover everything, but you always have to do a monthly price and all. But let's go to Medicaid too. Usually Medicaid is a very different. According to the CMS fact sheet I wrote, Medicare is a more cooperative federal and state program in India, which these programs include traditional Medicaid, Healthy Indiana Plan for low-income adults, and coverage for children, pregnant individuals, people with disabilities, and elderly individuals. So basically, it serves low-income children, pregnant people, basically anyone that's more on the poorer side, I would say. But also it can include the coverages they usually covers usually hospital physician services, behavioral mental health services, and preventive care, long-term care as well. It kind of makes sense, because just why Medicaid is for these low-income people is because usually they don't have that much money to cover everything, and what if their child has some sort of mental health disability going on or mental health issue, they need to go to Medicaid, because they are going to be the people that are going to cover that. Unlike Medicare, like I said, Medicaid is basically more needs-based, and meaning income and household circumstances a lot matter more. So Medicaid is more best described as a national framework instead of a state, but it's state administered. According to CMS the quick facts I saw, Medicaid is funded both by the federal government and the state, and each state administers its own Medicaid program. Sorry, I'm walking over my words. So basically, the states, they set eligibility standards, they decide the type, the duration, and the scope of the service, and they set provider payment rates, because health insurance it's expensive. So in Indiana, this means state designs and manages Medicaid programs like HIP while following federal guidelines. So Medicaid is not local, but is a state run with national structure. So you might be asking, even though I did seem like I talked about how Medicare goes more or older individuals, Medicaid goes for more needs based. So let's talk about a little more, clarifying the key differences. So Medicare is more based on age or disability, regardless of income, while Indiana Medicaid is based on financial need and eligibility category. And Medicare is more of a federal program administered nationally, while Medicaid is administered by the state of Indiana with federal oversight. which basically means Indiana runs it, while Medicare is like all over the place. And let's go to the coverage focus. And Medicare primarily covers like medical and hospital services, while Indiana Medicaid focuses on more on the broader support, especially for low-income families, like going on with like like I said, mental health services, all that kind of services they might offer. And let's go a little bit on the cost. Medicare involves more premiums, deductibles, and cost sharing because, it's worldwide. But Medicaid typically offers lower or no out-of-pocket costs because, like I said, it's more for low-income individuals, so they don't have to worry about that. So in conclusion, Medicare and Medicaid serve different but equally important roles. They're there to help people, but in different ways. Medicare is supposed to be helping more of the older individuals, while Medicaid is supposed to be there for low-income people. Like how Medicare has a lot of deductibles, these people might have a lot of might retire very wealthy, while Medicaid is obviously there for people who don't make that kind of wealth in their lifetime. Medicare is also more federal administrative program focused on, like I said, older individuals and people with disabilities, while Medicaid is more focused on low-income individuals. And also needs-based as well. Understanding like how these programs like differ helps clarify how health coverage is covered, like it's structured across federal and state levels, and which means like we get to see how these coverages like actually work and how they actually benefit different kinds of people. And overall, I think it's working. They're doing their own part. Medicare is there for the more older individuals, for the elderly, while Medicaid is there for the low income people who obviously can't afford that kind of Medicare. But no out of pocket coverage really helps these low income people. So I think that's better understanding how these certain individuals in these different circumstances benefit from the healthcare system. Thank you for listening.